And I know I'm going to twist up a bit of our order here, but when you talk about those three things, the next thing I think about is a real patient story and what that really looks like in practice. And Drew has his own personal story that he said he was willing to share. And I gave him every opportunity to opt out of that, of course. But there isn't anything I think more powerful than a personal testimony of how something has really worked for you. And Drew, if you would walk us through your patient experience, I think now would be a really perfect time for that.
Indeed, happy to do it. So, unfortunately, on or about Easter weekend, 1st of April, I did get COVID, and my wife and I both. She had a very simple version; it just came and went, and mine was bad. I was going downhill for 2 weeks and climbing out for a full week. I was laying in bed, and it was awful. It was thankfully for me, it wasn't life threatening, but it was the worst I've ever. It was the sickest I've ever been in my life. And what I learned in that period of time, and I had Nice Healthcare as a distribution partner, and we're live in Colorado. I'm a member of Nice, and we just got it going. And lo and behold, I used Nice Healthcare 13 times in the month of April. They came to my house 4 times, including in my front hall here. I did a chest X-ray because COVID affected my lungs, and they needed to know if I had pneumonia and so on. So 13 times. Unrelated, I got a prescription refill. They came to my house 4 times. I had virtual visits. I basically talked to them every other day, and they pulled me through, which was probably the scariest illness I've had in my life. And the cost to me was zero, zero. What can you do in this healthcare system 13 times and not have to worry about what comes out of your wallet, not knowing what is this going to lead to? So long story short, I got through it. They were there with me. They pulled me through, and it was exactly what I needed, which was care in the home, care virtually when I couldn't be seen, or just laying in bed and so on. So, wow, it was a godsend.
And the perfect example of what we talked about earlier, which is a solution that meets people exactly where they are.
Mhm.
It's incredible. 13 times, 13 visits, no cost shares to you, and no claims to your health plan, which, in a scenario like that, obviously the first and most important priority is the patient, the health and your recovery. But so often people recover and they feel great, and then they get hit with the whammy of a bill, and the employer gets hit with their
Yeah.
whammy of the bill, and all of a sudden you're like, wow, it's really expensive to be healthy. It's really unfortunate. It's the second, illness, maybe we can call it, that bill that comes back around after you've had an experience like that in the system.